Question 1. In applied behavior analysis, BCBA, what is the primary focus of study? A. Internal thoughts and feelings. B. Hypothetical constructs. C. Observable and measurable behavior. D. Medical diagnosis. Answer: C. Observable and measurable behavior. This question tests your understanding of the core focus in BCBA. The key phrase primary focus points directly to what behavior analysts study. BCBA is fundamentally concerned with behavior that can be seen and measured in the environment, not internal states that cannot be directly observed. By focusing on observable behavior, practitioners can objectively collect data and determine if interventions are effective. For example, instead of saying a child is frustrated, BCBA focuses on the observable behaviors associated with that frustration, like crying or hitting. The takeaway is that BCBA is an objective science based on what you can see and count. Question 2. What is a consequence in the context of BCBA? A. An event that happens before a behavior. B. An event that happens after a behavior. C. An internal thought or feeling. D. A medical diagnosis. Answer: B. An event that happens after a behavior. This question asks for the definition of a consequence in BCBA. The word consequence in this context specifically refers to what follows a behavior. Understanding consequences is crucial because they influence whether a behavior is likely to occur again in the future. Consequences are observable environmental events that occur immediately after a behavior happens. For instance, receiving a sticker immediately after cleaning up toys is a consequence for cleaning behavior. Remember that in BCBA, a consequence is simply what comes after the behavior you're looking at. Question 3. Which of the following is the best definition of reinforcement? A. A consequence that decreases the future probability of a behavior. B. A consequence that increases the future probability of a behavior. C. An event that occurs before a behavior. D. A method for punishing unwanted behavior. Answer: B. A consequence that increases the future probability of a behavior. This question asks you to define reinforcement, a fundamental principle in BCBA. The definition highlights that reinforcement is a type of consequence that has a specific effect on behavior. It makes that behavior more likely to happen again in the future. It doesn't matter if the consequence is good or bad in a general sense, only whether it increases the behavior. Giving a child a preferred toy after they say a word, if that makes the child say the word more often in the future, is an example of reinforcement. The key takeaway is that reinforcement strengthens behavior. Question 4. A child cries when their parent leaves the room. When the parent returns, the child stops crying. The parent returning is an example of what process if it makes the child more likely to cry in the future when the parent leaves. A. Positive punishment. B. Negative reinforcement. C. Extinction. D. Positive reinforcement. Answer: B. Negative reinforcement. This scenario describes negative reinforcement because a behavior, crying, is increasing in the future due to the removal of an aversive stimulus, the parent's absence. The keyword increases the future probability is the core indicator of reinforcement. The stimulus being removed is the parent's leaving, which the child finds aversive, hence the crying. The parent returning removes this aversive state, and if this consequence leads to more crying when the parent leaves in the future, it's negative reinforcement. Think of negative reinforcement as escaping or avoiding something unpleasant, which then strengthens the behavior that led to that escape or avoidance. Question 5. Providing a child with a favorite toy immediately after they correctly follow an instruction, resulting in the child following instructions more often in the future, is an example of A. Negative reinforcement. B. Punishment. C. Positive reinforcement. D. Extinction. Answer: C. Positive reinforcement. This question illustrates positive reinforcement. The keywords are providing a favorite toy and resulting in the child following instructions more often in the future. Positive reinforcement involves adding a stimulus, the toy, after a behavior occurs, which then increases the future likelihood of that behavior. Following instructions, this process adds something desirable to increase the behavior. Receiving a paycheck for completing work is another example of positive reinforcement. The paycheck, added stimulus, makes working in the future more likely. Remember, positive reinforcement adds something to strengthen behavior. Question 6. Which dimension of behavior refers to the time elapsed from the onset of a stimulus to the initiation of the response? A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer: C. Latency. This question asks about a specific dimension of behavior measurement. The phrase time elapsed from the onset of a stimulus to the initiation of the response is the precise definition of latency. Duration measures how long a behavior occurs, frequency is how many times it occurs, and IRT is the time between responses. For example, if the teacher says, "Write your name," stimulus, and it takes the student 5 seconds to pick up the pencil to start writing, initiation of response, the latency is 5 seconds. Latency tells us how quickly a behavior begins after a cue. Question 7. What is the definition of extinction in ABA? A. Presenting an aversive stimulus after a behavior to decrease it. B. Removing a preferred stimulus after a behavior to decrease it. C. Withholding reinforcement for a previously reinforced behavior. D. Providing reinforcement for a desired behavior. Answer: C. Withholding reinforcement for a previously reinforced behavior. This question tests your understanding of extinction, a common behavior change procedure. Extinction occurs when the reinforcement that was maintaining a behavior is no longer provided, leading to a decrease in the future frequency of that behavior. It's crucial to understand that extinction is not ignoring the behavior itself, but stopping the reinforcement that was making it happen. If a child tantrums to get attention, reinforcement, and the attention is no longer given for tantrums, the tantrum behavior may decrease over time. This is extinction. Extinction works by breaking the link between the behavior and the consequence that fueled it. Question 8. A stimulus that signals that reinforcement is available for a particular behavior is called a S delta, SD. B. Conditioned stimulus, CS. C. Discriminative stimulus, ST. D. Unconditioned stimulus, US. Answer: C. Discriminative stimulus, ST. This question defines a discriminative stimulus, ST, a key concept in stimulus control. An ST is a stimulus that, in the past, has been associated with the availability of reinforcement for a specific behavior. It sets the occasion for a behavior to occur, because the individual has learned that performing the behavior in the presence of this stimulus is likely to result in reinforcement. For example, a stop sign, ST, signals that pressing the brake pedal behavior is likely to result in avoiding a ticket or accident, reinforcement avoidance of punishment. And ST tells you when reinforcement is on. Question 9. What is an S delta, SD? A. A stimulus that signals that reinforcement is available for a particular behavior. B. A stimulus that signals that reinforcement is not available for a particular behavior. C. A stimulus that elicits a reflexive response. D. A neutral stimulus that acquires reinforcing properties. Answer: B. A stimulus that signals that reinforcement is not available for a particular behavior. This question asks about the S delta, which is the opposite of a discriminative stimulus, ST. And S delta is a stimulus that, in the past, has been associated with the absence of reinforcement for a specific behavior. It signals to the individual that performing the behavior in the presence of this stimulus is unlikely to result in reinforcement. For instance, a closed sign on a store door, SD, signals that attempting to enter behavior will not be reinforced by being able to shop. The S delta tells you when reinforcement is off. Question 10. The process by which a behavior occurs more often in the presence of a specific stimulus than in its absence is called A. Generalization, B. Discrimination, C. Shaping, D. Stimulus control. Answer D. Stimulus control. This question defines stimulus control, which explains why behaviors happen in some situations but not others. Stimulus control occurs when a behavior is under the influence of an est, more likely in its presence, and an S delta, less likely in its presence. This means the environment is controlling the behavior. For example, saying hello only when you see someone you know, ST, but not when you are alone, SD, shows stimulus control over saying hello. Stimulus control shows that behavior is related to the situation it happens in. Question 11. What is the definition of frequency as a measure of behavior? A. The total time a behavior occurs. B. The number of times a behavior occurs within a given time period. C. The time from a stimulus to the start of a behavior. D. The time between occurrences of a behavior. Answer B. The number of times a behavior occurs within a given time period. This question tests your understanding of frequency measurement. Frequency is a count of how many times a specific behavior happens. It's often expressed as a rate when a time period is included, example, 5 instances per hour. But the core measure is the count itself. For example, counting how many times a student raises their hand during a 30-minute lesson is measuring the frequency or rate of hand raising. Frequency gives you a simple count of occurrences. Question 12. Measuring the total time a behavior occurs from start to finish is called A. Latency, B. Frequency, C. Duration, D. Rate. Answer C. Duration. This question asks about the measurement of how long a behavior lasts. Duration is the measure of the total time a behavior occurs from the moment it starts until the moment it stops. For example, measuring how long a child engages in tantrum behavior or how long a student stays on task are examples of duration recording. Duration is simply a measure of time spent doing the behavior. Question 13. What does IRT stand for in ABA measurement? A. Inter-response time. B. Intra-response time. C. Independent response training. D. Integrated reinforcement technique. Answer A. Inter-response time. This question tests your knowledge of ABA measurement terminology. IRT stands for inter-response time, which is a specific measure of the time elapsed between 2 consecutive instances of the same behavior. It's the time from the end of one response to the beginning of the next occurrence of that same response. For example, measuring the time between a student finishing one math problem and starting the next math problem is measuring IRT. IRT tells you how much time is between responses. Question 14. What is rate of behavior? A. The total time a behavior occurs. B. The number of times a behavior occurs per unit of time. C. The time from a stimulus to the start of a behavior. D. The number of behaviors in a session. Answer B. The number of times a behavior occurs per unit of time. This question defines rate as a measurement of behavior. Rate is essentially frequency. Count divided by a unit of time. It tells you how often a behavior happens relative to a time period, making it easy to compare behavior across sessions of different lengths. For example, saying a child hit 10 times in 30 minutes, a rate, is more informative than just saying they hit 10 times if you don't know how long you were observing. Rate gives context to the frequency of behavior. Question 15. Which measurement method involves observing whether a behavior occurs at any point during a specific interval? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Frequency recording. Answer: B. Partial interval recording. This question describes partial interval recording, a common discontinuous measurement method. In partial interval recording, you divide the observation period into intervals and record if the behavior occurred at any point during that interval, even if it was only for a moment. This method is often used for behaviors you want to decrease. If the behavior happens even once in a 10-second interval, you mark it as having occurred for that interval. Remember that partial interval recording tends to overestimate the actual occurrence of a behavior. Question 16. What is shaping? A. Providing reinforcement every time a behavior occurs. B. Reinforcing successive approximations to a target behavior. C. Linking individual behaviors together to form a complex skill. D. Withholding reinforcement for a previously reinforced behavior. Answer: B. Reinforcing successive approximations to a target behavior. This question asks about shaping, a procedure used to teach new behaviors. Shaping involves reinforcing behaviors that are closer and closer to the desired final behavior, successive approximations, while gradually stopping reinforcement for behaviors that are not as close. This allows you to build complex skills by starting with something simple and reinforcing steps towards the goal. Teaching a child to say water might start by reinforcing any sound like wa, then walla, then water. Shaping helps teach behaviors that the person doesn't already do. Question 17. What is a behavior chain? A. A single behavior that occurs very frequently. B. A sequence of responses linked by stimuli that are both consequences for the prior response and discriminative stimuli for the subsequent response. C. Reinforcing closer and closer approximations to a target behavior. D. A set of behaviors that occur independently of each other. Answer: B. A sequence of responses linked by stimuli that are both consequences for the prior response and discriminative stimuli for the subsequent response. This question defines a behavior chain, which is a sequence of behaviors performed in a specific order. In a chain, each step produces a stimulus that acts as a reinforcer for the step just completed and also serves as the discriminative stimulus, STI, for the next step in the sequence. For example, washing your hands involves a chain: turning on the water, getting soap, rubbing hands, rinsing, turning off water, drying hands. Each step leads to the next until the final step is reinforced. Clean hands. Behavior chains are used to teach complex skills composed of multiple steps. Question 18. In a backward chaining procedure, when is reinforcement delivered? A. After the first step is completed. B. After every step is completed. C. After the last step is completed. D. At the beginning of the chain. Answer: C. After the last step is completed. This question asks about backward chaining, a method for teaching behavior chains. In backward chaining, the learner is prompted through all steps of the chain except the last one. They are taught to perform the last step independently, and reinforcement is provided immediately after they complete that final step. Once they master the last step, the learner is taught to independently perform the second to last step and the last step, and so on, until they can perform the entire chain. Reinforcement is always delivered after completing the terminal, last step of the chain that the learner is currently working on. Question 19. What is a prompt in ABA? A. A consequence that increases the future probability of a behavior. B. A consequence that decreases the future probability of a behavior. C. An antecedent stimulus or event that helps a learner perform a correct response. D. Withholding reinforcement for a previously reinforced behavior. Answer: C. An antecedent stimulus or event that helps a learner perform a correct response. This question defines a prompt, which is a teaching tool used in ABA. A prompt is something added to the environment before or during a behavior to increase the likelihood that the learner will perform the desired response correctly. Prompts are temporary and are designed to be faded out over time. Examples include physically guiding a hand, saying part of a word, pointing, or showing a picture. Prompts are cues to help the learner get it right. Question 20. The gradual removal of a prompt after the target behavior is occurring reliably is called A. Shaping, B. Chaining, C. Fading, D. Generalization. Answer: C. Fading. This question describes the process of fading, which is used in conjunction with prompting. Fading is the systematic process of reducing or eliminating the prompt that was used to help a learner perform a behavior. The goal is for the learner to be able to perform the behavior independently, without the prompt. For instance, if you used hand-over-hand guidance to teach writing, fading would involve gradually reducing the physical support until the person writes on their own. Fading ensures the learner becomes independent of the prompt. Question 21. What is generalization? A. Performing a behavior in the presence of a specific stimulus, but not others. B. Performing a behavior in the presence of stimuli that are similar to the one it was taught with. C. Reinforcing successive approximations to a target behavior. D. Linking individual behaviors together to form a complex skill. Answer: B. Performing a behavior in the presence of stimuli that are similar to the one it was taught with. This question asks about generalization, which is an important outcome in ABA. Generalization occurs when a learner performs a skill or behavior in situations, settings, or with people that are different from where it was originally taught. For example, if a child learns to say dog when shown a picture of their pet dog, generalization is when they also say dog when seeing different pictures of dogs, real dogs, or even hearing barking. Generalization means the learned behavior isn't tied to just one specific situation. It applies more broadly. Question 22. What is discrimination? A. Performing a behavior in the presence of a specific stimulus but not others. B. Performing a behavior in the presence of stimuli that are similar to the one it was taught with. C. Reinforcing successive approximations to a target behavior. D. Linking individual behaviors together to form a complex skill. Answer: A. Performing a behavior in the presence of a specific stimulus but not others. This question defines discrimination, another key concept related to stimulus control. Discrimination is when a behavior occurs more frequently in the presence of a specific stimulus, the ST, than in the presence of other similar stimuli, SDs. This shows the learner can tell the difference between when the behavior will be reinforced and when it won't. For instance, a child who says car only when shown a picture of a car, but not when shown a picture of a truck, is demonstrating discrimination between cars and trucks. Discrimination is the opposite of generalization. It's about responding specifically to the correct cue. Question 23. What is the main purpose of conducting a functional assessment? A. To diagnose a medical condition. B. To identify the function, purpose, a behavior serves for an individual. C. To teach a new skill. D. To eliminate all challenging behaviors. Answer: B. To identify the function, purpose, a behavior serves for an individual. This question focuses on the primary goal of a functional assessment. A functional assessment is a process used to determine why a behavior is occurring by identifying the antecedents, what happens before, and consequences, what happens after, that maintain it. The function refers to the purpose the behavior serves for the individual, typically related to getting something, attention, tangibles, sensory input, or getting away from something, escape. For example, a functional assessment might reveal that a child's hitting occurs only when asked to do difficult schoolwork, antecedent, and results in the schoolwork being removed. consequence, indicating an escape function. Understanding the function is crucial for developing effective intervention plans. Question 24. The A in the ABC recording model stands for A. Association. B. Analysis. C. Antecedent. D. Ability. Answer C. Antecedent. This question asks about the components of the ABC recording method, a fundamental tool in functional assessment. ABC stands for antecedent behavior consequence. This method involves observing and documenting what happens before the behavior, antecedent, the specific behavior itself, and what happens after the behavior, consequence. This helps identify patterns and potential functions of the behavior. For instance, in an ABC record, the antecedent might be told to clean room, the behavior falls to floor and cries, and a consequence, parent stops asking child to clean room. The A is always for antecedent. Question 25. The B in the ABC recording model stands for A. Baseline. B. Benefit. C. Behavior. D. Background. Answer C. Behavior. This question is also about ABC recording. In the ABC model, the B stands for the specific observable behavior that you are interested in. It's important that the behavior is defined clearly so anyone can measure it the same way. For example, instead of disruptive, the behavior might be defined as screaming words loudly for more than 3 seconds. The B is always the behavior you are observing. Question 26. The C in the ABC recording model stands for A. Caregiver. B. Collection. C. Cause. D. Consequence. Answer D. Consequence. Completing the ABC model, the C stands for consequence. The consequence is the event or change in the environment that immediately follows the behavior. As discussed earlier, consequences are critical because they are what maintain behaviors. In the ABC sequence, the consequence is recorded right after the behavior occurs. The C is always the consequence that happens after the behavior. Question 27. What type of functional assessment involves directly observing the behavior in the natural environment and recording ABC data? A. Indirect assessment. B. Functional analysis. C. Descriptive assessment. D. Experimental analysis. Answer C. Descriptive assessment. This question asks about different types of functional assessment methods. A descriptive assessment involves observing the behavior as it naturally occurs in the person's everyday environment without manipulating the environment. You collect data on antecedents, behaviors, and consequences, like ABC detail, to identify correlations, not direct cause and effect. For example, a behavior analyst might sit in a classroom and record when a student talks out, what happens right before example teacher asks question, and what happens right after example teacher ignores. Descriptive assessment gives you clues about the function based on real-life patterns. Question 28. Which type of functional assessment involves systematically manipulating antecedents and consequences to determine their effect on the behavior? A. Indirect assessment. B. Descriptive assessment. C. Functional analysis. D. Preference assessment. Answer C. Functional analysis. This question describes a functional analysis, which is the most precise type of functional assessment. A functional analysis is an experimental method where the behavior analyst intentionally creates different test conditions, example attention, escape, tangible, alone, to see which one reliably produces the behavior. This allows for a direct demonstration of cause and effect between environmental variables and the behavior. For instance, putting a child's difficult task in front of them and seeing if tantruming occurs primarily in that escape condition might confirm an escape function. A functional analysis directly tests why a behavior is happening. Question 29. What is an indirect functional assessment? A. Manipulating variables in the environment to see their effect on behavior. B. Observing behavior directly in the natural environment. C. Gathering information about behavior through interviews and questionnaires. D. Conducting standardized tests to assess cognitive function. Answer: C. Gathering information about behavior through interviews and questionnaires. This question describes indirect functional assessment methods. Indirect assessments collect information about a behavior without directly observing it or manipulating the environment. They involve asking people who know the individual well, like parents or teachers, questions about when the behavior occurs, what happens before after, and what they think the purpose is. Examples include interviews and rating scales. While useful for gathering initial information and hypotheses, indirect methods are the least reliable for determining function as they rely on memory and interpretation. Question 30. What is the main goal of conducting a preference assessment? A. To teach new skills. B. To find out which items or activities might function as reinforcers for a client. C. To decrease unwanted behaviors. D. To punish inappropriate behavior. Answer: B. To find out which items or activities might function as reinforcers for a client. This question is about preference assessments, and the keyword main goal helps you focus on understanding its purpose. A preference assessment is when you offer different choices to see what the client enjoys most or is most likely to choose. Knowing what they like helps us pick potential rewards that might make learning and good behavior more motivating. It's not designed to fix bad behavior. It's simply about discovering what might motivate the client. For example, offering a child a choice between a toy car, a book, or a snack helps identify which they prefer. Preference assessments are all about discovering potential motivators. Question 31. What is differential reinforcement? A. Providing reinforcement every time a behavior occurs. B. Reinforcing one behavior while putting another on extinction. C. Presenting an aversive stimulus after a behavior. D. Withholding reinforcement for a previously reinforced behavior. Answer: B. Reinforcing one behavior while putting another on extinction. This question asks about differential reinforcement, a powerful behavior change procedure. Differential reinforcement involves simultaneously reinforcing a desired behavior, or the absence of a behavior, while withholding reinforcement, extinguishing, for an undesirable behavior. The key is reinforcing differently depending on the behavior. For instance, if a child calls out in class, undesirity, but raises their hand, desirity, you might differentially reinforce by giving attention only when they raise their hand and ignoring calling out. Differential reinforcement is about strengthening the good stuff while weakening the challenging stuff. Question 32. Reinforcing a behavior that is incompatible with the target behavior is called A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of incompatible behavior. DRI. C. Differential reinforcement of alternative behavior. DRE. D. Differential reinforcement of low rates. DRL. Answer: B. Differential reinforcement of incompatible behavior. DRI. This question describes differential reinforcement of incompatible behavior. DRI. In DRI, you reinforce a behavior that cannot physically happen at the same time as the challenging behavior. For example, reinforcing sitting in a chair, incompatible with running around the room, is using DRI to decrease running around. Because sitting and running can't happen simultaneously, reinforcing sitting directly reduces the opportunity for running. DRI reinforces a specific behavior that makes the problem behavior impossible. Question 33. Reinforcing a behavior that is an alternative to the target behavior is called A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of incompatible behavior. DRI. C. Differential reinforcement of alternative behavior. DRE. D. Differential reinforcement of low rates. DRL. Answer: C. Differential reinforcement of alternative behavior. DRE. This question defines differential reinforcement of alternative behavior. DRE. In DRA, you reinforce any behavior that is a suitable alternative to the challenging behavior, even if it's not physically incompatible. The alternative behavior provides the same function, gets the same result as the problem behavior. For instance, teaching a child to tap someone's shoulder to get attention, alternative behavior, and reinforcing that while ignoring yelling for attention, challenging behavior, is DRA. DRA gives the person a better way to get what they want. Question 34. Reinforcing the absence of a target behavior for a specific period of time is called: A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of incompatible behavior. DRI. C. Differential reinforcement of alternative behavior. DRE. D. Differential reinforcement of low rates. DRL. Answer: A. Differential reinforcement of other behavior. DRO. This question describes differential reinforcement of other behavior. DRO. With DRO, reinforcement is delivered if the challenging behavior does not occur for a specified interval of time. If the behavior happens during the interval is reset. The reinforced other behavior is simply anything other than the target behavior. For example, if a child is reinforced with a sticker every 10 minutes, if they haven't hit anyone during that 10 minutes, that's DRO. DRO reinforces the absence of the problem behavior. Question 35. Reinforcing a behavior only if it occurs at a lower rate than it has in the past is called: A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of incompatible behavior. DRI. C. Differential reinforcement of alternative behavior. DRE. D. Differential reinforcement of low rates. DRL. Answer: D. Differential reinforcement of low rates. DRL. This question defines differential reinforcement of low rates. DRL. DRL is used to decrease a behavior, but not eliminate it entirely. The goal is simply for it to happen less often. Reinforcement is delivered if the behavior occurs at or below a certain rate within a period, or if there is a minimum amount of time between responses. IRT. For example, if a student asks too many questions, but you don't want them to stop asking entirely, you might reinforce them for asking no more than 3 questions in a 15-minute period. DRL helps you reduce a behavior's frequency, but keep it in the repertoire. Question 36. What is positive punishment? A. Adding a stimulus after a behavior that decreases the future probability of that behavior. B. Removing a stimulus after a behavior that decreases the future probability of that behavior. C. Adding a stimulus after a behavior that increases the future probability of that behavior. D. Removing a stimulus before a behavior that decreases the future probability of that behavior. Answer: A. Adding a stimulus after a behavior that decreases the future probability of that behavior. This question asks about positive punishment, another fundamental behavior principle. Positive punishment involves adding a stimulus, often something unpleasant or aversive, immediately after a behavior occurs, which results in that behavior happening less often in the future. It's important to remember positive means adding something and punishment means the behavior decreases. For example, if a child touches a hot stove, behavior, and feels pain, added stimulus, they are less likely to touch it again. Positive punishment adds something to weaken behavior. Question 37. What is negative punishment? A. Adding a stimulus after a behavior that decreases the future probability of that behavior. B. Removing a stimulus after a behavior that decreases the future probability of that behavior. C. Adding a stimulus after a behavior that increases the future probability of that behavior. D. removing a stimulus before a behavior that decreases the future probability of that behavior. Answer: B. Removing a stimulus after a behavior that decreases the future probability of that behavior. This question asks about negative punishment. Negative punishment involves removing a stimulus, often something per 4D, immediately after a behavior occurs, which results in that behavior happening less often in the future. Negative means removing something, and punishment means the behavior decreases. Taking away a preferred toy, removed stimulus, from a child who is throwing it, behavior, if this makes them less likely to throw toys in the future, is an example of negative punishment. Negative punishment takes something away to weaken behavior. Question 38. A procedure where reinforcement is made contingent on not engaging in the challenging behavior for a specified period, and if the behavior occurs, all access to reinforcement is lost for a set duration is called: A. Response cost. B. Timeout from reinforcement. C. Planned ignoring. D. Extinction. Answer: B. Timeout from reinforcement. This question describes timeout from reinforcement, a type of negative punishment. Timeout involves removing a person from a reinforcing environment or removing access to reinforcement for a specific period immediately following a challenging behavior. The key is that the environment or access they are removed from was reinforcing. For example, removing a child from a fun play area and having them sit quietly in a chair for a few minutes after they hit another child is timeout, if the play area was reinforcing. Timeout temporarily removes access to reinforcement to decrease the behavior. Question 39. A procedure where a specific amount of a reinforcer is removed immediately following a target behavior is called: A. Timeout from reinforcement. B. Planned ignoring. C. Response cost. D. Extinction. Answer: C. Response cost. This question defines response cost, another type of negative punishment. Response cost involves removing a specific amount of a reinforcer that the individual already possesses immediately after the challenging behavior occurs. This loss of reinforcement makes the behavior less likely in the future. For example, taking away a token from a token board, fining someone money for speeding, or losing minutes of recess are all examples of response cost. Response cost takes away something specific to reduce the behavior. Question 40. Systematically withholding attention for a behavior that is maintained by attention is an example of: A. Timeout. B. Response cost. C. Planned ignoring. D. Positive punishment. Answer: C. Planned ignoring. This question describes planned ignoring, which is a specific application of extinction for behaviors maintained by attention. If a functional assessment shows that a behavior is occurring because it gets attention, even negative attention, planned ignoring involves deliberately withholding that attention, which was the reinforcement. When the behavior occurs, this should lead to a decrease in the behavior over time. For example, if a child tantrums to get attention and the adult makes sure not to look at, talk to, or touch the child during the tantrum, this is planned ignoring. Planned ignoring removes attention as the maintaining consequence. Question 41. Which experimental design involves collecting baseline data, implementing an intervention, returning to baseline conditions, and then re-implementing the intervention? A. Multiple baseline design. B. Changing criterion design. C. Reversal design, ABA or ABAB. D. Multiple probe design. Answer: C. Reversal design, ABA or ABAB. This question describes the reversal design, also known as an ABA or ABA design. This single subject design is used to demonstrate a functional relationship by showing that the behavior changes when the intervention is introduced, B phase, reverses or returns towards baseline levels when the intervention is withdrawn, a phase, and changes again when the intervention is reintroduced, B phase. The reversal phase is key to showing the intervention, not something else, caused the change, For example, collecting baseline data on screaming. A. Implementing an attention intervention. B. Removing the attention. A. And then re-implementing the attention. B. To see if screaming decreases and then decreases again. Reversal designs are powerful for showing cause and effect. Question 42. Which experimental design involves implementing the intervention sequentially across different baselines, example, across different behaviors, settings, or subjects? A. Reversal design. B. Changing criterion design. C. Multiple baseline design. D. Multiple probe design. Answer. C. Multiple baseline design. This question describes the multiple baseline design, another common single subject design. This design demonstrates a functional relationship by applying the intervention to one baseline, example, one behavior, one setting, one person, while keeping others in baseline. The intervention is then sequentially applied to the next baseline, and so on. A functional relationship is shown if the behavior changes significantly only when the intervention is introduced for that specific baseline. For instance, teaching hand washing, behavior 1, teeth brushing, behavior 2, and hair combing, behavior 3, sequentially, starting the training for each only after the previous skill showed no change during baseline. Multiple baselines show the effect by staggering the intervention start. Question 43. Which experimental design is used to evaluate the effect of a treatment on the gradual increase or decrease of a target behavior by changing the required performance level over time? A. Reversal design. B. Changing criterion design. C. Multiple baseline design. D. Alternating treatments design. Answer. B. Changing criterion design. This question describes the changing criterion design. This single subject design is used when the goal is to gradually increase or decrease a behavior over time, rather than achieving a sudden change. The design involves setting a specific criterion, performance level, for the behavior and reinforcing the individual for meeting it. Once that criterion is consistently met, the criterion is changed, usually made stricter or higher, and reinforcement is contingent on meeting the new level. For example, if the goal is to increase jogging from 5 minutes to 30 minutes, the criterion might start at 5 minutes, then change to 10, then 15, and so on. The changing criterion design is great for shaping behaviors that need to happen gradually. Question 44. What is an operational definition of a behavior? A. A description of the function the behavior serves. B. A clear, concise, and objective description of the behavior. C. A summary of the antecedents and consequences of the behavior. D. A hypothetical explanation for why the behavior occurs. Answer. B. A clear, concise, and objective description of the behavior. This question asks about an operational definition, a crucial element in ABA for accurate measurement. An operational definition describes a behavior in observable and measurable terms, clear enough that two independent observers could agree on whether or not the behavior occurred. It avoids subjective language. For example, instead of saying a child is aggressive, an operational definition might be any instance of hitting another person with an open or closed hand. An operational definition ensures everyone knows exactly what behavior is being measured. Question 45. Why is objective measurement important in ABA? A. To prove the behavior analyst is correct. B. To ensure interventions are based on opinions. C. To allow for reliable data collection and evaluation of intervention effectiveness. D. To confuse parents about the client's progress. Answer. C. To allow for reliable data collection and evaluation of intervention effectiveness. This question highlights the importance of objective measurement in ABA. Objective measurement relies on observable and measurable data, free from personal bias or interpretation. This allows different people to collect data reliably and consistently, which is essential for tracking progress accurately and determining whether an intervention is actually working. If measurement isn't objective, you can't trust the data to make informed decisions about the intervention. Objective data lets you see if the plan is making a real difference. Question 46. What is a key characteristic of behavior according to ABA? A. It is always problematic. B. It is observable and measurable. C. It is primarily influenced by internal states. D. It only occurs in humans. Answer: B. It is observable and measurable. This question reinforces a core concept introduced earlier, the definition of behavior in ABA. A defining characteristic of behavior in ABA is that it must be something you can see and count. This focus on observable and measurable events is what makes ABA a scientific approach. While internal states might be real, ABA focuses on the outward actions that can be agreed upon and recorded. If you can't see it or measure it, it's not typically defined as a behavior for direct analysis in ABA. Question 47. A motivating operation, MO, is an environmental variable that A. Temporarily alters the effectiveness of a stimulus as a reinforcer and alters the frequency of behavior that has been reinforced by that stimulus. B. Occurs after a behavior and influences its future probability. C. Signals that reinforcement is available for a specific behavior. D. Is paired with a neutral stimulus to create a conditioned reinforcer. Answer: A. Temporarily alters the effectiveness of a stimulus as a reinforcer and alters the frequency of behavior that has been reinforced by that stimulus. This question defines a motivating operation, MO, a concept that helps explain motivation and variations in behavior. An MO is something in the environment that changes how much you want a certain reinforcer at that moment, value-altering effect, and influences behaviors that have gotten you that reinforcer in the past, behavior-altering effect. For example, being thirsty. MO makes water a more effective reinforcer, value-altering, and makes you more likely to engage in behaviors like asking for water or going to the kitchen, behavior-altering. Memos explain why what is reinforcing and your motivation for certain behaviors can change moment to moment. Question 48. If a stimulus has been paired with a known reinforcer and now functions as a reinforcer itself, it is called a unconditioned reinforcer. B. Conditioned reinforcer. C. Discriminative stimulus. D. Punisher. Answer: B. Conditioned reinforcer. This question describes a conditioned reinforcer, also known as a secondary reinforcer. A conditioned reinforcer is a stimulus that started out neutral but acquired its reinforcing properties because it was repeatedly paired with a primary, unlearned reinforcer or another conditioned reinforcer. Money is a classic example. It's not inherently reinforcing but becomes so because it's paired with obtaining many other reinforcers. A conditioned reinforcer's value is learned through association. Question 49. A stimulus that is reinforcing without any prior learning history is called a conditioned reinforcer. B. Generalized conditioned reinforcer. C. Discriminative stimulus. D. Unconditioned reinforcer. Answer: D. Unconditioned reinforcer. This question defines an unconditioned reinforcer, also known as a primary reinforcer. These are stimuli that are inherently reinforcing because they are necessary for survival or are biologically important. They don't need to be paired with anything else to function as reinforcement. Examples include food, water, warmth, and shelter. These things are reinforcing from birth without needing to be taught. Question 50. What is the purpose of establishing a baseline for behavior? A. To implement the intervention immediately. B. To determine the current level of the behavior before intervention. C. To punish the behavior. D. To teach a new replacement behavior. Answer: B. To determine the current level of the behavior before intervention. This question asks about the purpose of baseline data collection, a critical first step in behavior change interventions. Baseline refers to the data collected on the target behavior before any intervention is introduced. It shows how often, how long, or how intensely the behavior is occurring under existing conditions. This provides a point of comparison to measure the effect of the intervention. For instance, counting how many times a child hits before starting a behavior plan gives you the baseline rate to compare against data collected after the plan is in place. Baseline data shows you where the behavior is starting,